is episode 99 of the Real World Wellness Podcast. Hi everyone, I'm Christine Lehman, a certified nutrition therapist and the reverse diabetes coach, which is also the name of my website. Again, that's reversediabetescoach.com. Please check it out. And I see clients by Skype video and in person in Alexandria, Virginia. So today I really want to dive in and talk about insulin and insulin resistance. And first, what is insulin? So insulin is a hormone made in the pancreas, which is an organ located behind the stomach. And the pancreas consists of many cells called islets. And there are beta cells within these islets that make insulin and release it into the blood. Insulin is also a major player in your metabolism, and that's the way your body uses digested food for energy. So the digestive tract breaks down carbohydrates, which are mainly sugars and starches found in many foods, into glucose. And your body definitely needs glucose as a form of energy, but that is a form of sugar, and that's how it enters your bloodstream. But the question becomes when you have too much of it. But with the help of insulin, it's well regulated because the cells throughout the body absorb it and use it for energy. So after a meal, your blood glucose levels rise, and then the pancreas releases insulin into the blood to bring the levels back down. So insulin and glucose travel in the blood to cells throughout the body. And insulin primarily functions to help your muscle, fat, and liver cells absorb the glucose from the bloodstream, which helps lower your blood sugar levels. Insulin also stimulates the liver and muscle tissue to store excess glucose. So that stored form is called glycogen. And insulin also lowers your blood sugar levels by reducing glucose production in the liver. So again, it's not just your pancreas, the liver is involved as well as your muscle and fat cells. So in a healthy person, glucose and insulin just function seamlessly and they remain in the normal range. When it begins to get problematic is when your insulin levels start to rise. And that's in response to a diet that's high in starchy carbs and sugar. And then afterwards, insulin resistance occurs because your muscle and fat and liver cells don't respond to insulin properly. So remember, they are helping, their role is to absorb the glucose, right? And to help store it as well. And that's what lowers your blood sugar levels. So when they can't do their job, they can't easily absorb the glucose from the bloodstream, and therefore your glucose and sugar levels rise because frankly they don't have anywhere else to go, and so they just end up in your bloodstream. So when that happens, your body needs higher levels of insulin to push the glucose into the cells again. So the beta cells in the pancreas try to keep up with this increased demand by producing more and more, and that really leads to hyperinsulinemia, which is when you have too high levels. And then that can go on for years because as long as your body has enough insulin and the beta cells are able to produce enough of it, it can overcome this insulin resistance, allowing your blood sugar levels to stay in the healthy range. However, over time, you can develop insulin resistance, and that also leads to type 2 diabetes and prediabetes because the beta cells frankly just can't keep up with the increased demand for insulin. And then without enough insulin circulating, that excess glucose builds up in the bloodstream again because it's not being stored and used properly. And that's really what can also lead to prediabetes. By the time you have prediabetes, you're already in the early stages at least of insulin resistance. So it's a serious thing to understand and to be mindful of. And unfortunately, a lot of the medical profession does not necessarily test for this. So I'll talk about that in a minute. But I also want to highlight that insulin resistance is a major factor in metabolic syndrome. And if you recall from my blog posts and podcasts, that metabolic syndrome includes low density lipoproteins, or LDL, high triglycerides, and another marker for metabolic syndrome is low HDL, or high density lipoprotein, which is the good cholesterol, as well as high blood pressure and high blood sugar. So it's a constellation of these multiple factors. Insulin resistance is also a risk factor for many other diseases besides diabetes, which I've already mentioned, including obesity, arteriosclerosis, which you may remember is a major factor in heart disease and stroke, polycystic ovarian syndrome, cancer, and even Alzheimer's disease. Alzheimer's disease, some people are calling the new type 3 diabetes. So the important thing to know here is that insulin resistance and hyperinsulinemia certainly can precede prediabetes. So that is often the last thing to increase. So for many people, a fasting glucose test, which is the typical test that your doctor will use to test diabetes and to detect it, really may be too late. You probably already have insulin resistance certainly if you have type 2 diabetes, and you're at least well on your way. If you have pre-diabetes, your insulin levels probably are going to show up too high. So remember that your insulin spikes even before your blood sugar rises. So that's a very important point that I want to make here, because I don't think that's well known, and which we'll talk about in a second. That's very important to figure out and to find out if you have that. Find out if your insulin levels are already too high. So, because high insulin levels are the first sign that can precede type 2 diabetes by even decades. So this is pretty amazing. And the damage can begin even with slight changes in insulin and blood sugar. So I really recommend that if you're at risk, and you could be over the age of 50, if you already have signs of metabolic syndrome, which I just talked about, if you have prediabetes, gestational diabetes, a family history of diabetes, polycystic ovarian syndrome, and or carry around weight around your abdomen, these are all risk factors for insulin resistance. So I would definitely recommend that you get tested for both blood sugar or plasma glucose and insulin. And there is a way to measure both, and it's called a 2-hour insulin glucose challenge test. It's a 2-hour glucose tolerance test, which can help detect high insulin levels. And unfortunately, doctors rarely order it. This should be done when you're fasted, usually overnight, and with blood sugar and insulin levels checked at fasting, so before you eat anything or drink any beverages, perhaps other than water, and then again at 1 and 2 hour intervals. So it can take 2 hours, which you may think it is a little bit longer than maybe what you're used to in terms of testing, but at the same time you do get a good read on both your glucose and your insulin levels. And then also we'll show you what your levels are before and after you eat. And that's very important, because your blood levels, as I mentioned, not only your insulin, but your blood levels rise after you eat. So your blood sugar levels should be at fasting definitely under 99, and ideally closer to 80 milligrams per deciliter. And then they shouldn't rise above 110 or 120 milligrams per deciliter after 1 and 2 hour checks. And your insulin should be less than 5 milligrams per deciliter at fasting, and should never rise above 30 milligrams per deciliter after 1 and 2 hour checks. So those are the numbers for testing. And it's very important to ask for this, and I think the ideal time is at your annual physical. So don't be hesitant or reluctant to ask your doctor for this particular test. So what can you do if you have insulin resistance? Well, as you heard, the good news is the earlier you catch it, the more likely you are to prevent it and head off diabetes, as well as the other kinds of diseases that I've mentioned. But even if you have insulin resistance, there is still a lot you can do with lifestyle. So this applies whether you are at the early stage or even a little bit further along. But the sooner you get a handle on this and start to manage it, the more likely your cells are to absorb glucose again, because you want to try and restore insulin sensitivity. When your cells are damaged, that's when they cannot absorb glucose. So you want to try and reverse that and create insulin sensitivity so they can function properly. So let's talk about diet. You may be familiar with the glycemic index and then the glycemic load, which is based on a serving size and a little more practical. Well, there's also an index called the insulin index. And I've been looking at that, and the good news as far as trying to simplify your life and your diet is that most of the foods and the carbs that are highly glycemic tend to also produce a high insulin response, such as white potatoes, white bread, white rice, the white hazards as they're often known. In general, pure carbohydrate, sugars, and starchy foods have a high correlation between glycemic and insulinemic responses. So a diet that would help lower your blood sugar, such as a paleo diet, will also lower your insulin response. However, lately I have more gone for a primal diet because of the health benefits found in probiotics. So Primal, the main difference between that and a paleo diet is Primal allows more cultured or fermented dairy, such as yogurt and kefir. And I don't have insulin resistance, and therefore I drink kefir in particular. I only get it from my farmer, so it's grass-fed and no hormones and antibiotics, and that's important. And there are at least 20 strains of probiotics, so it has more probiotic strains than yogurt. However, I have since learned for people who have insulin resistance, it's not a good option because the whey protein in milk products in general is rapidly digested and absorbed to release amino acids into the circulation, according to certain studies, which have shown that the most potent insulinemic amino acids are the branched chain ones, specifically leucine, isoleucine, and valine, which are found, unfortunately, not only in milk, but fermented milk. Sadly, a dose of fermented yogurt produces as high an insulin response as a slice of white bread. So if you have insulin resistance, or you're even at the early stages, I suggest that you eliminate all dairy, including fermented dairy, until you can bring your levels back into the normal range. Now, of course, meat contains amino acids. We talk about complete proteins. So if you're on the obese side and you want to lose a significant amount of weight and reduce insulin resistance, you should eat more white fish and chicken than red meat, including steak, because red meat has these amino acids as well that I've been talking about. Now, if you're a normal weight, you can eat steak, which again produces a higher insulin response and therefore has a higher insulin count occasionally, with a dose of healthy vegetables and some starchy carbs. Also, if you have to watch your fructose intake from natural sweeteners. So a paleo favorite of mine is coconut sugar, but it is made up of sucrose, which contains 50% fructose. So you're better off with small doses of honey. Again, raw pure honey, and try to get it from a farmer if possible. Blackstrap molasses, maple syrup, or date sugar, which is very concentrated, so you only need a small amount. And I want to emphasize that because, your body still will absorb sugar and recognize it as sugar. So you want to limit that to small amounts and an ideally occasional use. And I will talk more in the show notes about and provide resources there that explain the insulin index in more detail. So exercise is another important component in any program to reverse insulin resistance and improve your blood sugar, cholesterol, and blood pressure numbers, again, metabolic syndrome. So the research shows that you can do this best with aerobic, interval, or resistance training, and you may want to do a combination of them. In fact, I recommend that you do resistance training along with interval and or aerobic training. The research shows that you can do this even independent of weight loss, but of course this may contribute to weight loss as well. So I'll talk more about the research on insulin sensitivity in the next episode and whether insulin shots should ever be considered or are there better alternatives. So stay tuned for part 2 of this series, and I hope you have a great, healthy week.